Hi, and welcome to part 3 of the Laryngeal Anatomy Review. I'm Steve Tasko, and we left off part 2 with discussions of uh, the neurology of the larynx and mentioned how the course of the peripheral nerves can be instructive as to the kinds of problems that can affect the innervation of the larynx. I mentioned that surgical procedures in the thorax and neck can be problematic, but also disease itself, and sometimes surgical attempts to alleviate the disease. So tumors of the thyroid gland, as we see in this picture, or tumors in the mediastinum, chest area, or neck, can all impact nerve function of the larynx. Now, the target of these nerves, at least the efferent portions of these nerves, are muscles, and we need to use muscles to be able to uh, create the conditions under which phonation can occur. And we differentiate muscles of the larynx between what we call intrinsic muscles, and these are muscles where both the origin and insertion of the muscle itself is within the larynx on the laryngeal cartilages. And then we have a set of muscles that are referred to as supplemental and extrinsic muscles. Some authors distinguish between these two types, that extrinsic muscles have an origin or an insertion within the larynx and an origin or insertion outside of the larynx, whereas the supplemental muscles have no origins or insertions within the larynx proper, but actually have attachments on the hyoid bone, and therefore often distinguish it from some of these other muscle types. The intrinsic laryngeal muscles really have some key actions in that they impact the vocal fold function itself. In other words, the position, tension, and length of the vocal fold are primarily dictated, but not solely dictated, by intrinsic muscle activity. In order to understand these kinds of activities, it's important to distinguish between two general positions of the vocal folds. Adduction, and this is when the vocal folds are approximated toward the midline, versus abduction with a B, where the vocal folds are away from one another, resulting in an open glottis, or at least a partially open glottis. So there can be actions of adduction and abduction, which change the position of the vocal folds, but also muscle activity can create increases or decreases in tension and length of the vocal folds. Typically, stretching or pulling on the vocal folds tends to lengthen and tense the folds, whereas shortening the folds can slacken and slacken the folds. And so it's the relationship between tension and length are actually is interrelated, and the primary effect of that is to thin and tense the vocal folds, or thicken and slacken them, and therefore change their modal vibratory frequency. Now we're going to move quickly through the key intrinsic muscles of the larynx. I'm not going to spend a lot of time on fine details. Most of you have done that in an anatomy class. What we're looking at here on the left side right here is a lateral view of the cricoid with an arytenoid sitting on top. The lateral cricoarytenoid muscle is a muscle that attaches, obviously, the cricoid and the arytenoid, and it's located on the lateral surface of the cricoid. So it has muscle fibers that sort of rise up from the lateral surface of the cricoid and insert onto the muscular process of the arytenoid cartilage. And you can see in this particular view here, if you look from above, these are the fibers that you're looking down on of the lateral cricoarytenoid. And you can see they're coming off of the lateral surface of the arytenoid, and or the cricoid, and when they contract, they're going to pull on the vocal muscular process, and thereby swing or pull the vocal processes toward the midline, and therefore serve to adduct the vocal folds. As mentioned before, this is innervated by the recurrent laryngeal nerve on each side. Now, the posterior cricoarytenoid is a true antagonist to the lateral cricoarytenoid. This is now a posterior view of the arytenoid with the cricoid with the arytenoids on top, and The posterior cricoretinoid has an origin that's sort of broad-based on the posterior surface of the cricoid, and then fibers go up and again attach to the muscular process of the arytenoid cartilage, something like that. And the fiber orientation is roughly like this on each side. And so when it contracts, it's going to pull on the muscular process. And here's a superior view where these are the posterior cricoretinoid muscles. And it pulls in this direction. And when it does that, it's going to cause the vocal processes then to move away from one another and have the effect of abducting the vocal folds. These muscles are innervated primarily, again, are innervated by the recurrent laryngeal nerve. Now, the thyroretinoid muscle is an important muscle in that both structurally and functionally. Structurally, it actually makes up a portion of the vocal folds. A large portion of the thyroretinoid, the vocalis portion, is located just lateral to the vocal ligament right in the actual vocal folds themselves. You can see over in this view here. And so contraction of these muscles, the orientation of the fibers is along the length of the vocal fold. When they contract, they would shorten the vocal folds and sometimes can slacken it. So the tension of the vocal folds can be altered by the actions of the thyroretinoid. There are other fibers of the thyroretinoid muscle that was often referred to as the external portion, or the thyromuscularis portion, that can have an effect of providing some adductory effect as well. So there can be some adduction. Again, innervation, recurrent laryngeal nerve. The interretinoid is a muscle that sits right between the bodies of the adjacent arytenoids, and the fibers tend to run both horizontally between these two structures, and then there are also some transverse fibers as well, or oblique fibers, I should say, that kind of run on an angle. Obviously, when these muscles contract, it pulls the arytenoids closer together, causing an alignment of the folds toward the midline, or adduction, again, innervation, the recurrent laryngeal nerve. And then cricothyroid is the only muscle that is not innervated by the recurrent laryngeal nerve. It's innervated by the external branch of the superior laryngeal nerve. Its origins and its site of attachments is on the inferior surface of the thyroid and the superior surface of the cricoid, and the fibers run in such a way that, like this, so that when it contracts, it tends to cause action about the cricothyroid joint. So unlike the other muscles that primarily act upon the cricoarytenoid joint, this acts upon the cricothyroid joint. What it tends to do is stretch and thin the vocal fold by making it longer and thinner, and actually increases the vibratory frequency of the vocal folds. So it's often referred to as a pitch regulating muscle, but it really truly is both a combined action of the cricothyroid and thyroretinoid that are involved in modulating pitch or fundamental frequency. That's the end of part 3, and we'll have a short part 4 as well.